Earlier this week, we told you about a small study showing that people who regularly smoked marijuana or ate THC-laced edibles showed signs of early cardiovascular disease, similar to tobacco smokers. Researchers found vascular function was reduced by more than 40% in marijuana smokers. The function fell by more than 50% in people who eat THC edibles regularly compared to those who don't.
9 News medical expert Dr. Pyle Coley joins us this afternoon to break down this study. The public feelings around marijuana have really shifted, but I know, like, from the medical side, we'll still hear a lot of warnings. So marijuana and your heart health.
Yes, not just heart health, but all kinds of health. So I call marijuana tobacco 2.0.
Really?
Yes, and unfortunately, we have this perception that it's safer, it's natural, recreationally, we can use it and not worry about it. In fact, over 1 million adults over the age of 18 in Colorado have used it in the last month, and that's about 36% of our adults. But we really have to keep in mind that if we smoke it, and even the edibles, as we just learned from this study, can actually really damage multiple organs, damage our blood vessels, which supply multiple organs, increase our risk for cancer, for cognitive dysfunction, and just like tobacco, it's highly addictive. And there are risk factors for addiction. So if you start smoking it in adolescence, if you vape it, you actually get a higher concentration delivered inside. And of course, if you have a family history of addiction problems, that can make it worse as well.
This is news to me, really. I mean, I know that there's been definitely some studies and findings, and now, though, cardiovascular health, that is another new anecdote to all of this. So you're a cardiologist, we were just talking about it, right? Tell us what these findings mean to you, and are you alarmed?
You know, I tell my patients every single day, and we have known for some time, that marijuana is not good for your heart. In fact, I have a number of young people who come in, have nothing wrong with them, except that they use recreational marijuana 3 times a week or more, and they can have electrical problems. So we know that it can cause arrhythmias, which are electrical disturbances in the heart. We know that your risk for heart attack in the hour after you smoke can actually be 5-fold higher.
Wow.
And the reason for that is it causes an increase in heart rate, causes an increase in your blood pressure. So if you're someone who's older, already has those pre-existing health problems, that can certainly make it worse. We also know that it triggers inflammation, which is how plaque and cholesterol deposits in the artery accumulate and how they pop open to cause those heart attacks and strokes. And now we're learning that even edibles, which we thought were safer, can actually induce problems with the blood vessel function. And think about our blood vessels. They supply every organ in our body, including our brains, our vision, our kidneys, our liver. So that can be a real problem.
Speaking of edibles, is there anything in this study that shows a difference between the type of consumption of marijuana, edibles, vaping, smoking, traditionally, like, that is better or worse than the other?
So I was surprised to see these findings because I thought edibles would be better, but edibles are seeming to have the same effect on blood vessels as tobacco smoke in terms of their function. Now, what was different with the edibles as opposed to smoking was that some of the blood tests, the nitric oxide, which is a chemical in our blood that affects the blood vessels, was worse with smoking than it was with edibles. But to me, this was a bit of a wake-up call because I always told my patients probably edibles are better because you're not actually smoking it into your body with those carcinogens and all those chemicals. But now I'm going to start shifting my message and actually say that studies have shown that edibles are bad for your blood vessels just as much as smoking.
What about medicinally? Or what about, I've taken edibles to go to sleep at night. So
some people, pain management.
Yes.
So there are some times where people are directed that way.
So I would say medical uses of marijuana, I very much am in support of. And so you were talking about chronic pain patients, we're talking about cancer patients. I am not a huge fan of using this for sleep because it distorts your sleep architecture. So it helps you sleep, but it actually doesn't give you better quality of sleep. It's almost like drinking alcohol, right? You fall asleep faster, but then you wake up and you don't kind of feel quite as rested, or taking a Benadryl. So I like to use kind of more old-fashioned things to help with sleep. And my concern is over time, especially chronic use, we don't know what that does to your sleep quality over the long term. Does it affect the way that sleep actually helps to regenerate your body?
But to build off of your question, some people are taking it for a medical reason. So then it's really a cost-risk analysis in some situations, probably, at least from a cardiovascular health perspective, right?
Yeah, very much so. I mean, if you are prescribed these compounds by your doctor for medicinal reasons, then they've weighed the risks and benefits. And everything we do in life obviously has risk, obviously has benefit. This compound, marijuana, came about for its medicinal purposes, actually. We've really sort of exploited it for recreation, but it came about as a medicine initially. So if you're using it but under the guidance of a physician in a supervised setting where they know whether it interacts with your medications, they know your risk profile, they know what dose to give you, they know whether you're getting dependence or addiction, these are safe ways to use this this compound. But recreationally, lighting up with your friends 3-4 times a week just for fun or just for sleep, we're starting to see that's not a good idea.
And it's especially not a good idea for kids and teens. And for some reason, I feel like a lot of kids and teens, because it has been more normalized now, because it's legal, that they feel some sort of a societal permission that it is okay. What would you say to parents or grandparents out there, or maybe a teen watching?
Yeah, I would say really be careful, because you're starting down a slippery slope that's going to affect so many things in your life. I mean, the increased risk of psychosis, especially in the adolescent population, schizophrenia, depression, anxiety, because you get this paradoxical anxiety where we're seeing already a spike in mental health problems in our teen population, and then you layer this on top. We also know that teens who use marijuana regularly have a 17% risk of getting addicted, as opposed to 9 to 10% if you're an adult, because the earlier you start, the more you can get addicted. And then the brain development really worries me. So it's not just the psychiatric issues, but the fact that your brain is still evolving and you're rewiring it in a way that we don't understand, we don't know the long-term effects of. So you could be signing up for a whole life of long-term complications. So don't start if you haven't started.
Yeah.
If you're already using it, try to minimize the use as much as you can and talk to your doctor.
Some pretty good advice.
I know, great recommendations, Dr. Coley, as always. Thank you.